This is Santara News. After several days of intense rain, floodwaters have spread through Metro Santara's low-lying neighborhoods, carrying polluted river water into homes, streets, and local markets. Hospitals are now reporting a surge in severe gastro-emissional infections. Doctors say patients are not responding to commonly prescribed antibiotics.
This is a crisis that Santara is facing, an outbreak where contaminated water is carrying resistant bacteria from environment to homes, markets, and hospitals. But flood did not create the problem, it exposed it. And Santara's geography makes this crisis worse.
Industrial zones, hospitals, peri-urban farms, wet market, and houses are all closely connected by the same river and the drainage system. So, untreated hospital and industrial wastewater carries resistant bacteria into drainage channels. Meanwhile, peri-urban farms and aquaculture contribute resistant organisms through runoff and food supply chains. So, when monsoon flood arrive, contaminated water spread into homes, streets, and markets.
The core pain point is very simple. Santara cannot control what it cannot see. So that's why we propose Clean Flow Santara,
a system that monitors AMR hotspots, controls wastewater and influence, tracks antibiotic use, and activates community protection before, during, and after the next flood. The hotspot monitor network is based on the data collection of antibiotic residues at potential accumulation sites. All of this information will feed into a citywide AMR dashboard. The dashboard will show three things: where the hotspots are, how severe the risk is, and whether an emergency protocol should be activated.
That is really matters because early detection changes the response. Instead of just waiting until patients arrive at hospitals, Santara can identify high-risk areas before the contamination spreads the city. And that is also why the monitoring network is politically attractive.
For the Environmental Protection Agency, it provides the evidence needed to enforce pollution control. For public health agencies, it creates an early warning system for outbreaks and post-flood infection surge. And for the Department of Finance, it is a relatively cost-effective intervention because it gives citywide visibility without requiring immediate large-scale infrastructure expansion.
But detection alone is not enough. Once the city knows where AMR is coming from, it must reduce the contamination at the source.
So, our next solution is hospital wastewater control. However, upgrading every hospital wastewater system at once would be too expensive and politically difficult. So we propose a targeted approach. We will begin with high-risk medical wastewater at high-risk hospitals located near rivers and drainage channels. For these hospitals, we would support practical pre-treatment measures such as UV disinfection, filtration, and strengthen wastewater handling before discharge. During flood alert, these hospitals will enter the emergency protocol, which means an enhanced wastewater treatment mode, reducing discharge risks when the city is most fragile. Our third solution focuses on pharmaceutical industrial influence governance. We propose a threshold system with both penalties and incentives. Still based on analysis from the monitor network, if a factory repeatedly exceeds the discharge threshold, financial penalties will apply. But if it remains consistently below the standard, it becomes eligible for a Green Pharma label.
Factories with Green Pharma label will receive public recognition and priority in government procurement. It creates a clear message. Cleaner production is not only an environmental responsibility, but also a business advantage. In other words, this is a double-win regulatory model. Our fourth solution focuses on farms and agricultures. Every antibiotic purchase will be linked to a QR code logbook. When an antibiotic or purchase were used, the QR code is scanned by an authorized farm health worker. The logbook records the antibiotic type, date of use, dosage, purpose of use, and target animals. this does not criminalize farmers. It gives the city a clearer picture of antibiotic use and help the farm shift from routine preventive use towards a more responsible treatment use space. We'll also establish antibiotic return points in farming areas and communities. These points will collect expired or unused antibiotic, preventing antibiotic from being dumped into drains, ponds, or household waste. This helps maintain food production while reducing antibiotic misuse, making the program more accessible to producers and more sustainable in practice. Last but not the least is the flood resilience community protection. When the AMR dashboard reaches a risk threshold, Sentara will activate a coordinated response. High-risk hospitals will shift into enhanced wastewater treatment mode. Pharmaceutical factories will temporarily restrict high-risk liquid waste discharge. Safe drinking water supply points will be activated. In the most fragile flood-prone communities, the city will distribute flood family health kits. These kits will include water purification tablets, gloves, antibacterial soap, oral rehydration salts, and safe water storage bag or containers. This part of the plan directly responds to community organization because it protects people who face the highest exposure but often have the least infrastructure. We also propose decentralized wastewater treatment system, or DWATs, for selected peri-urban and wet market areas. A wet market will operate hygiene practices and also creates an emergency protocol. When risk rises, the protocol will guide which seafood product or areas need stronger washing, which market need temporary disinfection, which stores will pause handling high-risk products, and how to prevent cross-contamination. This is also why public health agencies support this intervention. It reduces post-flu infection surges before they escalate into wider outbreaks.
Now, let's dive into the financial analysis of our strategic response. Following a strict cap of $10 million, our team rejected blanket spending. Instead, our philosophy is to secure the baseline with full coverage while maximize the impact through precision piloting.
Our total $10 million investment is distributed to balance urgent equity need with long-term systemic change. 40% secure our community resilience, while the remaining 60% is precision allocated to high-risk clinical, digital, and agricultural hotspots. We dedicate $4 million to community-wide resilient infrastructure, providing informal settlements with climate-proof sanitation and safe water to systematically dismantle AMR transmission pathways before flood strike. We also invest $2.5 million as seed capital to pilot modular advanced treatment units in 10 high-risk hospital hotspots, setting the green standard for the entire healthcare sector to adopt. Our another $2.5 million AMR hotspot monitor network serves as APRU Sentara's digital nervous system, delivering the real-time data intelligence required to detect and contain resistance long before the crisis involved. Finally, we allocate $1 million to agri-food stewardship, transforming agricultural practices into a transparent, accountable system through QR code traceability to secure our food supply from farm to market.
But how do we ensure this intervention don't just vanish after 4 years? We've designed a 3-pillar sustainability metric to ensure self-sustaining operations.
First, data from our $2.5 million monitor web will enforce heavy regulatory fines on non-compliant factories, 100% recycling revenues to fund future OMN costs. Second, we merge our water level and biodata into Sentara's micro-flood control dashboard, core-sharing long-term municipal budgets. Third, by year 4, the pilot benchmarks become mandatory licensing laws, shifting all future upgrade costs entirely to the commercial healthcare market.
This financial wisdom perfectly mirrored the true spirit of One Health approach. We recognize that the health of human, agriculture, and our shared ecosystem are completely independent. Our plan does not treat the environment and agriculture merely the instrument for human health.
For human health, we mitigate clinical exposure and support targeted stewardship. For animal health, our cure logs eliminate antibiotic misuse to safeguard veterinary wellness. And for environmental pathways, our monitor web protects the biological integrity of Sentara's water and soils while control chemical residues in ARG reservoirs.
The core of our proposal is one simple idea. Metro Centauro must use data to see the problem clearly and use prioritize to act where it matters most. This approach does more than just minimize costs. It maximizes feasibility, political support, and measurable impact within 4 years. And behind this wonderful initiative is our passionate and interdisciplinary team from HKUST. We all have life science background, we will go far beyond biology, combining technology, design, and empathy to create real impact.
That is the future we propose for Metro Centauro. Smarter data, targeted action, and a safer city for people, animals, and the environment. Thank you.